So we are looking at coming. We're looking at as a lateral projection of the hip, also known as a Danelius Miller method, okay, of imaging the hip. So try to look at it and everything. Okay, so it's basically a radiographic technique. It's used to obtain a very clear lateral view of the hip joint. Okay, clear lateral view of the hip joint. So purpose is to provide what? A lateral image of the hip joint without moving the affected leg. So see it. So what is it? It's commonly used in trauma just to evaluate fractures of the femoral head and acetabulum. So how does the patient lie? They are lying facing up, so supine position. So the unaffected leg is what? Elevated and flexed, while the affected leg remains flat. Okay, this is the affected leg that is flat like this. You understand? The other leg that is not affected is elevated. So the pelvis should not be rotated. All right. So central ray directed horizontally enters at the groin area of the affected side, and the central ray passes through the femoral neck. So image characteristics. Image you get here produces a lateral view of the femoral head, neck, and acetabulum. So of course nothing will be distorted. So you have a very nice image. So it's useful for dictating all those fractures and dislocation of the hip joints.